Hello, everyone. This is Erica Spicer Mason with the Becker's Healthcare podcast series. Thank you so much for tuning in. Today, I'm thrilled to be joined by two guests from Quest Analytics to talk about the benefits to payers of network benchmarking. We have with us Subhash Seelam, the Senior Vice President of Network Performance at Quest Analytics, and Bob Tavernier, the Sales Solution Executive at Quest Analytics. Subhash and Bob, welcome to the podcast. Thank you so much for being here today.
Thanks, Erica.
Thank you.
Yeah, thrilled to have you both. And before we get into our discussion, I was hoping you both might share just a little bit more about yourselves, give our listeners some context. Subhash, maybe we can have you get us started.
Sure, yeah. And Erica, thanks again for having us on the podcast here. So this is Subhash Seelam. I've been in the healthcare space, healthcare data space, I should say, for a little over 20 years now. Last 12 years, I spent time at Optum, and then prior to that, I worked for another healthcare data company that is now part of IQVIA. And the common thread across all my tenure in these two companies is data analytics, product, and basically telling a story with data. That's kind of where I spend most of my time. Bob?
Thank you, Subhash, and thank you again, Erica, for the opportunity. This is Bob Tavernier, Sales Solution Executive at Quest Analytics. I come from Healthcare Service Corporation, where I had the privilege and opportunity to serve across 4 major divisions for 25 years. Super excited to join Quest Analytics and bring my healthcare experience forward in supporting our network performance and benchmarking area of healthcare.
Fantastic. I really appreciate the intros from you both. And it sounds like you've definitely got the expertise to drill down a little bit more into this topic of health plans and their network performance. So, Subhash, I was hoping you could get us started and just kind of give us a bit of a broad idea of this topic area. How do health plan networks currently measure performance? And what metrics are most critical for evaluating the efficacy of these networks?
Sure. What a great way to kick off this topic or this discussion here. So health plans typically have about 5 or 6 major areas that they would measure themselves on. And the list I'm going to talk about is in no particular order. They're all equally important. So first what comes to mind is clinical related measures like outcomes, which is like HEDIS measure. That's a measure of care and service. Then quality measures and patient safety, hospital-acquired conditions come in this bucket. And then population health management, which is how are they managing their chronic conditions of the population, and preventive care, early detection, things like that. So that's the first one. And then the second area of measurement here is utilization. Like how is the utilization across, like, say, resource management and the services management going on? So meaning what is the geometric mean length of stay of my members when they encounter sepsis? Like, so the utilization is a big component of measurement for health plans, and also like how many tests are done, preventive or diagnostic and things like that. The third area of measurement is cost management, which is mostly like medical expenses. What's their medical loss ratio? What's the total cost of care? Again, a big measurement area for health plans. Then the fourth one will be, I want to say, member satisfaction. Like this is an important piece of measurement because they want their members to be happy. Member retention is a big measure for them, and it comes out through age caps, and that can impact their ratings with CMS, and also that will indirectly kind of impact their payment. So, and then the fifth one is operational efficiencies. Again, timeliness of care, claims processing efficiencies, these come to mind in that. And then last but not least, at least from a measurement standpoint, is regulatory and compliance related. These are they meeting NCQA standards, or are they in line with compliant with state and federal regulatory agencies? So those are kind of broad categories. There's a lot more under each of them that they measure, but I think in every other measurement they make can roll up into one of these 6 buckets that I just mentioned.
That's fantastic. Thanks so much, Subhash. So it sounds like we're looking at clinical measures, utilization, cost management, member satisfaction, operational efficiencies and compliance. It's a pretty wide range of measures that payers are looking at to measure their overall performance. So I wanted to take that just a little bit further. And considering all of those elements, can you kind of discuss the role that benchmarking plays in and how this helps payers really improve their network performance as well?
Yeah, I mean, the six measurements that I talked about. So let me extend that into the question around benchmarking. These six measures are not mutually exclusive. Each measure kind of like leads into the other. So your cost management can be a function of utilization and clinical outcomes. So they have very good relationship between each other. So benchmarking can create real measurable goals for these health plans. They reveal performance gaps in these areas for health plans, and they also can highlight areas of improvement. They also can highlight best practices, and they create awareness around what the industry standards are, et cetera, et cetera. So I'll give you a couple of examples here. So if I'm a health plan, like I want to know what is the risk-adjusted 30-day mortality rate for chest pain patients for my members with providers in my network versus those in my competitors' network, right? And if the rate is comparatively higher, I as a health plan will align incentives to improve this outcome or adjust provider composition in my network so members have access to higher quality providers. So that's an example where benchmark can come handy. The other thing is it's not only about clinical outcomes, as I mentioned earlier. Benchmarks can also help with cost management initiatives, like, for example, care coordination. How often my members that have been through a surgery post-discharge end up in an unscheduled ER event versus my competitors, right? Because that is an expensive affair for both from emotional standpoint, from dollar standpoint, everywhere, right? So if my number is higher than market average, I need to take action to like increase care coordination. So there is a flow. There's a follow-up call with the PCP post-discharge within 5 days or something like that. And the other important thing that benchmarks can provide is, do I have more low-value care providers compared to the market median, right? It's not always comparison against your competitor or the next health plan, but what is the market median? Meaning these are providers that have increased utilization with no evidence of improved clinical outcome. So for example, do my orthopedics go directly to a knee surgery without trying physical therapy like that? Because that can increase the cost of care without trying everything before going to the next big item, which is knee surgery. So benchmarks can really be critical to uncover gaps, subsequently diagnose the problem, and measure the impact of any corrective action. So again, I know, Bob, you probably have dealt with this directly in your time, during your time at the payer. Anything you would add for the role of benchmarks here?
Absolutely, Subhash. Benchmarking services serve really several roles in helping the health plan evaluate network performance. A few examples would be helping to serve as baselines for health plans through which network performance can be measured, compared against, utilized in evaluating network performance of the physicians and facilities. In the cases of network contracting, rate adjustments, negotiations, and renewals. Also supporting the provider and vendor contracts with contracts that are based with SLAs and performance guarantees, pay for performance, fee for service models, and also looking for like comparisons against provider specialists for member satisfaction. Additionally, they can also be utilized within payer organizations for achieving marketplace differentiators. So, for example, NCQA accreditation, to the point you mentioned earlier, population health equity initiatives. They're also used by regulators to help to establish the standard through which payers are required to achieve. For example, state departments of insurance, Medicaid RFPs, And then lastly, really focusing more around the quality lens of those providers and how do we ultimately steer members into higher quality providers and helping them with their healthcare decisions.
Yeah, Bob, Subhash, these are such great insights. And I think everything you've shared really speaks to how benchmarking can provide a lot of insights in so many areas of the business. I think we've touched on patient or member satisfaction. We've talked about clinical quality. We've talked about the quality of specialists and how providers are performing against market performance. And I can only imagine that these measurements, while helpful, they're probably rather complex to not just track and measure, but also to monitor. So, Subhash, I was hoping you could shed a little bit of light on the role of third-party benchmarking services. What role do they play in helping payers evaluate network performance? And if you could share any examples of how those services have provided actionable insights for network improvements, that would be fantastic.
Yeah, I mean, I think benchmarking as a topic in itself is pretty complicated. Like, I mean, you could have benchmarking in a variety of ways, right? So the first one is like you compare against yourself. That's still like, I mean, how did I do as a health plan last year compared to this year, right? So that's fundamental, that's foundational. Everyone should definitely be doing that. That's the bare minimum, right? You compare against yourself year over year, and are you trending in the right direction, right? And this is not super complicated, and doesn't necessarily need a third party resource, right? Because you got all the data, you crunch the numbers. So again, you need some analytics talent in house to kind of do that. But you crunch the numbers and you see how you're trending. And most health plans do this, like not rocket science, right? The challenge comes in, like, I mean, knowing what the market capacity is. I think that's where things start to get tricky and complex, right? If my, again, I'll go back to, like, say, if my members, when they end up in the hospital for pneumonia, if they are in the hospital for, say, 4.3 geometric millionth of stays as inpatient stays, is that good, bad? Like, I mean, okay, last year I was 4.2, I'm 4.3, I'm going up. But I mean, so knowing what the market is, I think is very important. And that's what benchmarks will do provide, right? And so there's a lot more I can go deeper into like the third party services. But again, I would love to hear from Bob his point of view, because Bob, you were in leadership role at health plan, and you dealt with this like firsthand. Like, did you do like homegrown benchmarking, or did you go outside and source it from outside? Like, and what are the pros and cons of each approach? Can you shed some light on that?
Absolutely. There definitely is some homegrown benchmarking, but it's also limited, typically line of business level. So we've noticed different levels of benchmarking when you're looking at a commercial population versus a government population. The other thing that we're thinking more about is, just the health equity lens, and how do you ultimately deliver guidance on actual insights from paying attention to race, ethnicity, language, cultural competency, inclusive programs for diverse member populations, and ultimately, how do you deliver a network that's going to help to meet that member population where they are in close proximity to what they need, and based on the type of care that they're looking for.
Yeah, I mean, going back to your question, Erica, around, like, I mean, third-party benchmarking services, actually, they seem that they are in this space for from a very long period of time. They have a lot of data, understand the nuances of it. So there are advantages to the third-party sources where they have a data infrastructure, talent pool, and discipline to maintain this on an ongoing basis, right? And then the other advantage is they have a very broad, holistic, and like global view of the problem at hand. Because it's like, because of that 10,000 hour rule, if you know, like, I mean, when you do this over and over again, you tend to get better and better, and your experience kind of speaks very clearly. Like, that's what, when somebody is like doing this purely on a day in, day out basis, so they can identify patterns very, very quickly, and they have the ability to layer additional data on top of the simple comparisons, like claims data, for example. They can take claims data on top of network data and provide much deeper insights, which is critical because sometimes your superficial just comparing counts can be misleading. I might have 25% of my provider network in really high efficient bucket, but are you really getting activity for this from this 25%? If this 25% drive only 3% of your activity, that's no good, right? So that level of detailed analysis can be possible when somebody is like really doing it on a day-to-day basis.
Mm. Yeah, really appreciate those add-ons, Subhash and Bob, especially your perspectives from all of your time at a payer organization. This has been a great discussion. Our time has come to a close so quickly, but I just wanted to thank you both again for joining this discussion, and also Subhash highlighting some of the capabilities and really the capacity that third-party services can really help organizations with in terms of understanding, having access to the benchmarking data, understanding the nuances and analytics as well. So again, thank you both for being on the podcast today.
Yeah, thank you, Erica, for the opportunity. Definitely enjoyed the conversation.
Thank you, Erica. Great opportunity. Appreciate it.
Thank you both again. And we'd also like to thank Quest Analytics for sponsoring this episode today. Listeners, please be sure to check out other Becker's Healthcare podcasts at beckershospitalreview.com.